Were you able to send him the link?
All right, Kemi, you can start when you're ready.
Thank you very much. I think I see more people joining in, so maybe we just give just a few minutes for us to have a number of people. Thank you. Okay, I think we can start now. Just checking to see James has joined in. Okay. All right, good morning, good afternoon, good evening, wherever you're joining us from. We would like to welcome you to this panel, which is titled Addressing Structural Inequities in the Global Health System, Charting Equity Through the Pandemic Agreement. My name is Kemi Gbadamosi. I'm a Director of Advocacy and Policy for the Africa Bureau at the AIDS Healthcare Foundation, and I'll be the moderator for this panel discussion. And I'm joined by experts in this field we will be talking through conversations around vaccine, therapeutics, diagnostic access. We'll be looking at issues of inequities in health and what the implications are across the divide, and also examining the pandemic agreement, the ongoing pandemic agreement, and the call for equity. What role can the pandemic agreement play in terms of achieving equity in the global health structure? But before we start, I'd like to just introduce our panelists. I am joined by Peter May-Baddock, who happens to be the Director of Public Citizens Access to Medicines Group. And Peter, basically, his day-to-day work requires him to direct public citizens' access to medicine. And they work with partners worldwide to make medicine available and affordable for all. So I'm sure with Peter's experience, you'll understand why he is on this panel for us to talk about global health equities and inequities as well. And also we would be joined by James Love. James is the Director of Knowledge Ecology International, and his training is in economics, finance, and his work focuses on production, management, and access to knowledge resources. And last but not the least is Timothy Wafula. Timothy is a health and human rights lawyer and the program manager for KELIN, which is the Kenya Legal Ethical Issues Network on HIV and AIDS. And together we would be addressing our topic for today. Again, it is addressing structural inequities in global health system, charting equity through the pandemic agreement. But before we go into the conversation for today, I'd like to just set the tone for us on why this panel discussion is important, particularly for such a time as this. Not too long ago, the world had to face COVID-19 pandemic, and we saw the deep inequities that COVID exposed to us. We saw that for many, especially in the global South, continents like Africa and African countries were unable, about 85% of African countries were unable to vaccinate their populations. And a large part of it was because wealthier nations were hoarding vaccines. Even as a result of that, a lot of lives were lost because of it. We also live in a time where global health for a long time is looked at as charity, where global South will have to depend like handouts when it comes to pandemic preparedness, response, or even prevention. And organizations like the AIDS Healthcare Foundation for a while have talked about the need for a global public health convention, one that allows for, stronger enforcement mechanisms, strengthened frameworks that would ensure that everyone has access to vaccines, to diagnostics, to therapeutics, that regardless of where people find themselves, that countries will be able to have access to life-saving commodities that can help them better prepare and strengthen their health systems as well. And as a result of that, we've also seen that in recent times, there has been conversations around the pandemic agreement. It's been over a year now when negotiations began with the pandemic agreement. And although we've seen some progress in terms of some of the call for equity, transparency, we see that a number of them are being green-lighted in the document, but then there's still a lot that needs to be discussed and needs to be addressed. For example, the issue of accountability. Is the pandemic agreement equitable enough to allow for regional production in terms of building the capacity of the Global South to produce its own vaccines, diagnostics, and therapeutics? There have also been the discussions around the pathogens access benefits sharing, and the contention around that as well. These are some of the things that we will be talking about today in this panel discussion. And please, as the speakers speak, if you have questions, we'd like for you to use the chat to drop your questions, but there will also be an opportunity at the end for you to also use the raise hand button, and we will give you an opportunity to join the conversation. But I want to underscore the importance of the pandemic agreement and why it has and needs to be equitable. One of the things that we believe and we're calling for is that we need a pandemic agreement that serves the needs of everyone. And I will speak even for myself as someone from the African continent. We need a pandemic agreement that speaks to Africa's needs, a pandemic agreement that allows for, the transfer of technology, of knowledge, of know-how, so that continents and even the Global South as a whole is able to respond more effectively during crises and pandemics. We saw just recently the issue of Mpox. Again, it looks as if the world has not learned much from COVID-19. We saw how long it took before, Africa facing the Mpox outbreak before vaccines could get to those who need it. And even at that, it is still insufficient. So I'd like for us to think on that for a moment. And I'd want to read a quote here, that basically underlines why it is important for us to take the issue of the pandemic agreement as critical as it should be. And that is the fact that it provides perhaps the last chance for the world to address the systemic inequalities in the global public health order. We have had a global public health architecture that has been inequitable for a very long time, and one that requires an overhauling, a rethinking, a retooling. So perhaps the pandemic agreement will provide that opportunity for us. But at the same time, it is also important that we cannot give in to corporate interests or profit motives. The goal will have to be to put lives before profit, even with the pandemic agreement. And as a globe, if we fail to enshrine equity as very fundamental to the global public health, then it means that many countries, all of us, in fact, will be forced to pay many times over. Now, we've had a long, drawn-out negotiation. It's been difficult, it's been contentious, but at the end of the day, we must continue to call for the demand to have a pandemic agreement that serves every one of us, the global North as well as the global South. And on that note, I'd like to just invite James, if he's already in the room, for us to talk a bit more about the pandemic agreement, because it is the right thing to do in terms of ensuring equity, transparency, accountability. These are all key. Mutual respect and partnership and collaboration beyond looking at global health as charity or as handouts. So, James, if you can hear me, I'd like to start off with you. The pandemic agreement right now is still ongoing. We don't have an agreement that, has been finalized. We're still in the process. We're getting to the end. If you could share with us, how can this pandemic agreement advance equity, and how can it be used to promote greater access for everyone?
James wasn't able to join yet. I'm with him in the
Okay.
background, so maybe you turn to Peter while we try to get him in the room.
Okay,
Yeah,
thank you very much. Let me go to you, Peter.
I can pick it up. So, and thanks so much, Kimmy. And I think you've laid out an important distinction between charity and justice as one of the key frames for all of us through which to see the pandemic agreement. It's potentially historic, at least conceptually it could be. We're talking about a grand bargain where wealthy countries, for example, are seeking access to viral information to help track outbreaks, and developing countries are seeking the means to protect their populations from those outbreaks, access to the medical tools that was denied during COVID, and also the means, knowledge, know-how, the intellectual property clearances to make those tools. There are many other interests at stake, the interests of frontline health workers, support for health workers, the will to fight generally, all of us to sort of cooperate toward the financing and a shared template to fight the next outbreak. If we can get there, a strong pandemic agreement would be transformative. But of course, practically, it faces a number of hurdles, and there are controversies still across the agreement, even though there's been progress in recent weeks. But two fundamental challenges at this point. I think one is, if you look across some of the articles where you see the greatest disagreement, folks close to the negotiations will talk about differences on research and development between countries, differences on intellectual property, differences on technology transfer. What these and other issues have in common is the extent to which the countries negotiating are willing to distance themselves from the interests of the pharmaceutical industry. All across the agreement, as a cross-cutting issue, developing countries are challenging wealthy countries to distance themselves further from pharmaceutical industry interests, to be willing to say no in order to more effectively and affordably share the medical tools that people need. And in our view, if wealthy nations are able to bend a little bit further on that, they may prevent the pandemic accord from breaking. There is, of course, in recent weeks, for particularly those of us in the United States, another extremely challenging dynamic. A strong anti-vaccination, anti-WHO movement has been present in our country for some time, and as of January 20th, it will be effectively in power in the personage of Donald Trump, and potentially an anti-vax conspiracist in Robert F. Kennedy Jr. leading our country's health ministry. We're going to fight that appointment, and I think we will win. But in any case, there's a strong base of opposition to WHO. So we'll return to that in a moment. We wanted to understand a little more about this influence of the pharmaceutical industry and the agreement, and on the positions of wealthy countries. Why are they so hesitant to share further medical tools to ensure affordability? And so we looked into the lobbying record. We searched our House of Representatives database for lobbying records that everyone lobbying our Congress is required by law to disclose. We searched between 2021 and 2024, looking initially at a precursor to the pandemic agreement, the TRIPS waiver, a debate on intellectual property at the World Trade Organization. We found that more than 500 lobbyists had been hired to lobby the US government on matters of intellectual property and disputes in pandemics in the vein of this TRIPS waiver. More than 90% of those lobbyists were hired by entities that oppose more flexible intellectual property rules, oppose facilitating access to the underlying know-how to make vaccines at a ratio of 32-1 in 2022. Later on, as the TRIPS waiver debate died down and the pandemic agreement picked up, our Chamber of Commerce, which represents major businesses in the United States, sent 49 lobbyists to lobby on the pandemic agreement to Capitol Hill in the first half of this year alone. One entity, nearly 50 lobbyists to lobby on the pandemic agreement. And while we don't have access to the positions represented, that is an entity that is very critical of the positions that developing countries are taking. So the point is that our pharmaceutical industry continues to have a very powerful role in influencing the position of U.S. government. And unless the U.S. government is able to say no to pharma, it's going to be hard to get those last measures of agreement over the line. You know, we all have been asked. We were all asked during the COVID pandemic to sacrifice, right? Our families. We masked, we social distanced, we took care of each other, we took time away from family and work as needed. It can't be that the one entity that's asked not to sacrifice is the pharmaceutical industry. They've got to contribute the way that we all do. Putting a pin in that, I mean, we planned this session a bit before the events of the U.S. election, which now, you know, perhaps swamps other considerations, at least as regards U.S. participation in the agreement. It is likely, in my view, that the United States is going to pull out of the World Health Organization. Some of us will challenge efforts to defund WHO. There might even be legal strategies to do that. But it means that going forward, unless there can be some rapid conclusion to pandemic agreement negotiations, and I heard Precious Matsoso from the negotiating body raise this possibility, hopefully even today. But that seems ambitious. And unless it can be done, we're talking about a pandemic agreement negotiation without the support of the United States. Now that can be done, but it means an accord that wouldn't get us to a very meaningful, an equally meaningful agreement to ensure the sharing of medical tools with people who didn't receive them during COVID. I've been talking for a while, so I'll pause there.
Thank you so much, Peter, because you've also gone into another question that we had, and that's what will be the implications of the U.S. election for the pandemic agreement, but even after the pandemic agreement. So I'll just like you to hold some of those your thoughts, because I'll come back to them, because we'll still have to talk about big pharma and what that means. I want to turn now to Timothy, because Peter has raised very salient issues. And you know that for the African continent, one of the things that came out of COVID was the African Medicines Agency, the need to have an agency that could help the continent when it comes also to vaccines, diagnostics, therapeutics, regulatory frameworks, and all of that. But before we go into discussing regional production capacity, I'd like to ask you, from an African perspective, what do you think are the implications of the pandemic agreement as it is now, and even with the push for an equitable agreement? What would be the implications for the continent?
Okay, yeah, thank you for that. And I think, thanks for the introduction and the initial thoughts. So I think on my part, I will start again from the point where you had stopped. I'll quickly just be sharing my screen. And yeah, and I will just start from the point where you'd left, just trying to speak about now for the region, how do we ensure we're able to achieve equity, and also just trying to look into what are some of the implications of the pandemic agreement towards this. Is the continent excited? Are there challenges and issues like that? And I think maybe just to start, we all remember this, and this is now during COVID, and it's been a rallying call that and a recognition that in the face of pandemics, we need to have global solidarity. We need to operate from that particular point if we're able to make any meaningful, if we're able to face pandemics together as a world. And I think from the COVID period, you've rightly in your introduction just pointed to some of the gaps that existed then, and which we saw that really spoke to inequity, and just a broken system. That was the reality then. And I think you also mentioned to that fact that it was a great lesson just for the African continent, seeing that at that point, compared to the high-income nations, the vaccine situation in Africa was spoke of this inequity. There were no vaccines as other nations were going for the second, third, and all that, was struggling with all these. And I think what was also witnessed, and I think a great lesson was, you've spoken to this, was that the system at that point really protected the monopolies, the pharmaceuticals, that really prioritized more of profits of people's lives. And there's issues around stockpiling, hoarding, nationalism, all these realities then were a great lesson of this was the reality then. And something that we could say was that we thought that maybe with this experience during the COVID time, that this will be a lesson to enable the world move forward together in a much better way as we face maybe possible future pandemics, that we learn from these and are better prepared for global solidarity moving forward. But I think just going back, but I think now COVID, post-COVID, now again faced with mpox, it's almost the same old stories. I think the headlines, the information coming out, it's almost a replica of what happened during the COVID pandemic. We see the need for vaccination, the need for access to diagnostics, the need for access to life-saving products. But again, the inequality, the divide really is strong, with African nations struggling to get access to vaccines, waiting for donations, at some point having to, whereby the promise is maybe vaccines will be available even after 6 months or so, will be available much longer than the time when the outbreak occurred. And I think this one, again, as we are continuing the conversation on the pandemic agreement, we at a point where we are supposed to actually say learn from these epidemics and pandemics that have hit us, and the kind of challenges that have been faced by low and middle income countries in access to life-saving products. And I think you'll remember that during the COVID pandemic, I think you also rightly spoke to this, and I will also just mention this in passing, maybe not going deeply into the regional mechanisms that we've set up, because also, and because of the challenges that exist. But I think you'll also notice that some of the stopgap measures that maybe were put in place to try and address maybe the challenges of access, for instance, COVAX facility at that particular time really also did not quite serve the purpose, facing the kind of challenges, for instance, lacking resources even to compete with the rich developed nations in terms of these. You will remember, and I think this one has been mentioned, the proposals around the TRIPS waiver went round and round and round and all that, and and these really faced a lot of opposition from the developed countries, to just ensure that there is intellectual property does not act as a barrier to access to these life-saving medical products, diagnostic kits, medical masks, and everything at that particular time. I am not even sure what the state of the waiver is, but I suspect it's still the conversations are still going 4 years later post the pandemic. So now coming to the pandemic agreement, is Africa excited about this agreement? So maybe I will just use the quotes that I've projected on the screen. So the idea of the pandemic agreement really sounds exciting, and I think was something that really excited maybe the continent to that now finally we are going to have maybe a mechanism that in future, when faced with such pandemics or epidemics, we're able to that would have learned from what happened during COVID, Mpox, and now we head to a system where there will be equity in access to vaccines, life-saving products at that particular time. So just looking at these is that most of the sentiments were that such proposed agreement is really is really much needed, and it's really much needed. However, as the discussions continued, then maybe we see the kind of gaps. So, for instance, you will see sentiments that the agreement for African countries and its relevance is really important, given also that the continent has faced a lot of emerging and re-emerging public health emergencies over the year, now compounded with climate change and climate challenges. Then that this means that having a system for global collaboration and serving the interests of the continent will really be much needed. And of course, the calls have been that for this to be achieved, again, the agreement must ensure that there's a system for equity in really strong and equivocal terms, and in terms that do not allow for derogation based on conditional language and things like that. And equity, that having equity in the text that will just ensure that it prevents having equity in the text to ensure that this is able to have African countries at a level whereby in face of pandemics, there's access. So yes, so the short answer to the conversation around the pandemic agreement and the excitement within the continent is that yes, it is viewed as a really critical tool or a critical agreement that could potentially assist the continent moving forward. However, now this is now the point where we come to the however and the kind of disappointment that exists currently with the current drafts of the text. So I know that and this one has been shared. There's been a lot of pushback, a lot of self-serving interests, especially from the developed nations, serving the private, speaking more for the interests of the private pharmaceutical companies in the interest of achieving global health security, and also just really disregarding most of the proposals coming from the Africa group, and having a language that is really weakened and not addressing some of the gaps that, or incorporating some of the lessons that we've learned, especially ensuring that first with the pandemic, we will not again have situations where rich nations are stockpiling doses of vaccine, refusing to share, and all that. So for us to have a really effective agreement, it really needs to have a strong equity language. It needs to really infuse most of the lessons learned from COVID, mpox, and past pandemics, so that as we're moving forward, we do not repeat the mistakes that or the issues that existed before. So maybe I can quickly just stop at this particular point, but happy to continue having the conversation. Thanks.
Thank you very much, Timothy. You brought out some really salient points there around, just taking us through the inequities of COVID, why the pandemic agreement is important even for the continent of Africa, and the implications therein, if especially if it is not strong and if equity is not at the core of the pandemic agreement. We're going to come back to discuss regional production capacity, because we know that when we talk about equity and we talk about access, it is important that continents are self-sufficient and to reduce reliance. But I want to turn the spotlight to James. I understand that James has joined us, so I'd like to turn to James a bit just to talk about, sorry about that. I'd like to turn to James. James, we talked about the pandemic agreement. We've set the stage in terms of what are the contentions that we're seeing now, and what are the possibilities that the pandemic agreement has in terms of reframing the global health architecture in a way that is mutually beneficial, not just only to the wealthy nations, but also even to the global south. But now, one thing that keeps coming up even with the pandemic agreement as we continue with negotiations is the issue of enforceability, so accountability at the end of it. What are the mechanisms that could help? So we still have the question on enforceability still hanging in the air. But at the same time, the recent report by Public Citizen on just how, lobbyists were working basically to push against TRIPS waiver also points to another issue on another end. Now, I want to ask you, given the challenges that we are seeing and continue to see, and even the contentions that still exist, how can the pandemic agreement still be able to promote greater access for everyone in terms of vaccines, diagnostics, therapeutics, or whatever critical commodities that countries need to enable them to be self-sufficient and to reduce reliance?
Hi, can you see me? My camera's, I think my camera's reversed here.
Yeah, you're turned around the other way, Jamie.
Yeah.
I'm using my phone here. Can you see me now?
We can't see you, but we can hear you.
Well, yeah. I'm going to point it at the mirror here because I can't figure out how to use the technology. I'm in Saudi Arabia right now, and I had a little trouble logging on here. Well, let me speak first of all about the pandemic treaty negotiations. In the beginning, I think the ambitions were quite a bit higher. People were, people were, talking about, no one's safe if anyone's safe, and we're all going to be in it together. And there were very kind of ambitious proposals put in the agreement in the when the negotiations started. Over time, the positions have hardened from the higher income countries. So the G7 plus primarily, which should be the United States, the European Union, the UK, Switzerland, Japan being like a group, if you want to sort of put them together, group probably the hardest liners, have really tried to block a lot of the equity provisions in the agreement. And what that has done is it sort of forced a lot of the equity provisions from other parts of the text into the part that has to do with the system where people collect pathogens and share the sequences or the materials from the pathogens. And so there's a proposal to have, a certain fraction distributed by the WHO of countermeasures, particularly vaccines and possibly drugs. But certainly vaccines. With companies that sign these contracts, and if countries had been more forthcoming in the chapters on technology transfer, the supply chain, on funding, and like six or seven other areas, I don't think that's where we'd be. Another thing I would say about the negotiation is it's right now there's a lot of kind of things are like so nuanced and weak, you should do this, or maybe you'll do this, or you have to do this, but it's only within your national capacity, and there's so many caveats built into the thing, and the framework is there's a few areas where it's really strong, but by and large, a lot of the areas it's not. That said, the agreement does provide for amendments going forward, for protocols, for annexes and things like that, and it has that sort of a voting system and sort of a way forward. And I think at the end of the day, so much of what you want done in the pandemic treaty can't be spelled out in detail in these negotiations. It has to come going forward. It has to have people involved that can actually make commitments in terms of resources and things like that. And it may involve some things that involve some optional protocols, but it's going to be kind of a confidence building thing going forward. But the current state is sort of going along, and then you've got this explosion of the U.S. election, and you have really bad appointments. But I'll focus a little bit on Robert F. Kennedy Jr., who's I think the most important figure, because he's been nominated for health secretary, and President Trump, knowing that he's going to have a hard time confirming some people, is trying to jerry-rig something where he can bypass Senate confirmation, because I don't think that RFK would have an easy time being confirmed. But I think that Trump, he knows he's putting up these really crazy people, and so I think he's trying to have these recess appointments where the people don't have to be confirmed by the Senate. Now, RFK is just announced that he thinks that he wants to tell the NIH, even though he's not running the NIH, but he thinks he would be, even as the HHS secretary. He wants to tell them not to do any research on infectious disease for a few years. He wants to stop the NIH research on infectious diseases, which is really bonkers. Now, in his book, I mean, some of this shouldn't be a surprise. In his book that he wrote about Fauci, which is really really an over-the-top book full of a lot of errors and things like that. But I will mention that he mentioned HIV 718 times in his book, and he referred to this guy, or quoted this guy, Peter Duesberg, 232 times in that book. And Peter Duesberg was one of these San Francisco, one of these sort of AIDS denialists that had persuaded Mbeki, for example, during the HIV pandemic, that HIV didn't cause AIDS and things like that. So, I mean, Robert F. Kennedy is like a super dangerous guy, and on top of that, you got this guy Elon Musk, who's one of the most toxic personalities, competing with Trump for one of the biggest, problems in the world. And his co-chair is Vivek Ramaswamy, who are coming up with these like really aggressive proposals to cut back federal spending and all sorts of things. So, like one of Vivek's proposals, for example, is to take employees in a federal agency and fire everyone who has a social security number that's even. And then after that's done, fire all the people that are left over that have a social security number that starts with an even number or something like just absolutely crazy stuff. And that would like reduce the workforce by 75% in an agency, just in a totally random way. I mean, so what's going on in the U.S. is so nuts right now that it certainly has an impact on a lot of things other than the pandemic treaty. In terms of the pandemic treaty, I think it's being designed in such a way that if the U.S. sort of gets back on track at some point, which I think is possible, that even if they don't sign the agreement or ratify the agreement, there will be these protocols and things like that that they can join as a non-member.
Looks like Jamie's frozen.
For the treaty and cooperate. I think that's where it's headed. And I think the U.S. will not be a part of it, but I don't think that's that big of a deal because they can join later. And I think that what will be important about the agreement is building confidence and trust in parties going forward and trying to find ways that it's really mutually beneficial for all the parties involved. And I'm sorry for this weird video where I'm looking into a mirror, but I couldn't figure out how to make the technology work.
It's okay. Thank you. Thank you, Jamie. I think the most important thing is you're making it work, and just thank you for sharing insights. I want to build on the question, just your submission right now around the U.S. election and what the horizon is for global health. And I want to go to Peter. You know, you started off talking about what the implications might be. And there are questions, you know, is the US expected to withdraw from the pandemic agreement? But I think James already answered a bit of that by saying it wouldn't really, even if it did, you know, the pandemic agreement is being set up in a way that there will be opportunities to maybe get back on track. But now we don't know if that is going to happen. But of course, given the current climate and, you know, who is also going to be at the helm of affairs and just the discussions around, you know, WHO, vaccines and all. I just want to ask you, how do you think we can protect and promote global health amidst all of this, especially with the US government that may not be very friendly or supportive in terms of global health?
Well, there's a few things we need to do. Thanks for the question. I mean, as Jamie indicates, having Robert F. Kennedy Jr. leading our health ministry would be disastrous. He's likely to be influential, at least for a time in any case, but blocking his confirmation is an important first step. And I'm optimistic that that we can get that done. I do think we're going to suffer a number of losses in any case, including the U.S. likely pulling out of WHO and the pandemic agreement. I very much appreciate that what Jamie is saying, and you know, Jamie's been at the negotiations this entire time, playing the long game to try and design agreement that a country like the United States can rejoin when sanity takes hold again. So you know, so that's positive. There are damaging unilateral actions that that Trump can take. There are others that would require congressional approval when it comes to sort of defunding global aid and vaccination fights. That's a little harder for him to do without bringing some more members of Congress along. And though his party swept the elections at the federal level, they're not all, you know, they're not all lunatics. So there are things that we can work to protect. At the same time, you know, we're in for a series of losses, and I think we each in the United States, it's a really difficult period for people working in global health. And I think we have to ask tough questions about which fights are really most worth our energy and where we can produce the best results. And of course, everyone's got a different remit. But, you know, in our case, we're fortunate to work with allies like you all around the world that can help demonstrate other access to medicines and other health equity victories in the meantime. So in those, you know, we need to challenge Trump. We need to encourage vaccine confidence and multilateralism. But in the areas where we can't get it, you know, we can work on other positive examples. So I'm actually speaking today from the offices of Afrigen in Cape Town, which is part of a WHO-backed collaboration for mRNA technology transfer, manufacturers across the global south working with top scientists around the world together to design south-based mRNA vaccines against new pathogens. And that's something that doesn't rely on someone like Donald Trump or RFK Jr. saying, yes, that's something that's South cooperation with support of partners around the world is moving on its own and will continue to move. And there are things we can do to support efforts like that and support access to medicines victories everywhere to help, as Jamie says, all of us pick back up the pieces when a different government is in power in Washington.
Thank you very much, Peter. Jamie, I want to ask you the same question as well, just in case you have any additional insights that you want to add on before we go to Timothy. You're muted.
Some people look at the first Trump term and they feel like, well, it wasn't so bad for global health. You had like we actually had a fairly good relationship with the Office of Global Health under that, and Alex Azar. You had
I think James is frozen.
a different thing right now. They're bringing in. I think you're really looking at a completely different thing in the second term. I mean, in the first term, Trump brought in these sort of competent, normal people in a lot of positions. Certainly in the health area, he had a lot of people that were really competent. I mean, they're regular, qualified people. They knew what they were doing. The second term, he's really shifting to the fringe. So it's a completely different personnel that he's bringing in and a different rhetoric. And he's sort of now, I don't know if he's been radicalized because he was indicted, he was actually booked, and threatened with jail time and stuff like that. But whatever it is, he is like one vindictive dude. So I think in the health area, it's been it's going to be a really, really rough ride. And we'll see. I mean, I think Peter's correct that there are members of Congress on both sides of the aisle that do care about global health and health in general. But Trump is consistently surprising people in how much he's been able to bend and bully members of his own party into going along with things. And so my advice to people is just assume it's going to be really horrible in terms of what the U.S. is up to. I mean, that's kind of, I think that has to, I mean, we might be surprised the other direction, but right now I think it's going to, I mean, just take the Global Fund, for example. I mean, the Global Fund is, I mean, if the U.S. pulls out of funding to the Global Fund, that's going to be pretty significant. Huge. I mean, that'll be huge, right? And if we stop funding, like UNICEF and things like that, I mean, like, which we probably will, because RFK is, hates vaccines. He hates vaccines for like measles and polio and things like that. I mean, it's really a radical. You just can't really. It's hard to put into words. Now, what is the strategy? I mean, how do you sort of respond to that? I think part of it is trying to get other non-U.S. components to pick up the slack and just sort of realize that the U.S. is sort of going off the rails. That's really what's going on right now.
Thank you, Jamie. So that's a good part to segue to Timothy, because now I want us to look at continents like Africa, the global south, in light of all these challenges and with the critical negotiations that are ongoing. Timothy, if you could please share what you think from the African perspective or the continental perspective, what can we do? You heard James' last point in terms of the onus will also now rest on the rest of the world, and I'll say even the global south, to be able to push for an equitable agreement, but an agreement that is enforceable as well. But what would be your own contribution? For example, organizations, civil society, what role can they play?
Okay, yeah, thanks. Yeah, I think it's it's a really concerning situation that again really needs to propel all of us to be able to collectively work together in just taking these actions. And I know on the part, for instance, of civil society, I think first of all is for civil society across the nation of the Global South, just to be aware of the global implication of some of the policy changes that are happening, especially within the US, and being able to see, to be at the forefront in terms of advocacy, where there's an opportunity that could, for instance, work towards promoting equity. So, for instance, with this particular agreement, having an agreement that really emphasizes this, puts equity at the forefront, really does create a good starting point towards just ensuring that we're able to protect and protecting that kind of access of vaccines, medicines across the world. But I think coming back again for the African continent itself, I know we've had missed opportunities in terms of enhancing local manufacturing, local production. I think this has been something that has been one of the missed opportunities that, again, the continent needs to really come back towards ensuring that initiatives that are put towards these are really working some of the barriers that have existed, regulatory, intellectual property, and any other barriers that have existed, that there's strong and concerted action towards addressing them so as to enhance the kind of capacity within the continent to be able to move forward. But I think lastly now, matters health really, and I will again just go back to my first slide, really call for global solidarity. So impact happening, whether it's in the global north, global south, really affects the world, has potential to affect all regions equally. So it's really important that solidarity, that working together, that's coordination, collaboration, really strengthened at all levels, be it at advocacy, litigation, in negotiation for global agreements, and all levels. I think maybe I just stop there. Yeah, take it back to you.
Thank you very much. And just looking at our time, I see that it's time for us to start winding down. But I want to just really appreciate the insights that have come through. So it's the fact that we do have a challenging time ahead of us, and how the pandemic agreement is able to maneuver through that time is going to be very critical. But it would be dependent on solidarity. It will be dependent on, advocacy as well. I think Peter mentioned that, and you talked about that, Timothy, as well, that it will be important to continue to galvanize support. And even if the US is not, maybe pulls out of the pandemic agreement, James has highlighted some key points for the rest of the world. I take it that we don't have to wait for the US. We don't have to wait. The US is very critical. It's important because it is a global power that is recognizable within the health space. It's also one of the largest donors when we talk about health response. So of course it is still critical, but even as we continue to think about what it might mean for global health with the new shift in the political landscape in the United States, I think the message is clear from this conversation so far. Outside of the United States, the rest of the world, and even as we continue to negotiate on the pandemic agreement, we have to ensure that it remains equitable. But also, Peter raised the issue of the pharmaceutical companies. He talked about it earlier when he opened up, because that still remains very critical. If we're talking about TRIPS waiver, if we say, like Timothy, you've highlighted the need for Africa to no longer have the missed opportunity when it comes to regional production. But you must agree with me that the ability for even the Global South to effectively produce or manufacture in terms of capacity would also still rely on technology transfer to a large extent. It would rely on the know-how, on the knowledge. And that's where the pharmaceutical company also comes in. It's the fact that collectively there needs to be that constant advocacy around ensuring that lives are put before profit, even with the pandemic agreement. But as we wrap up, I'd like to give each of you an opportunity to, first, before we do that, some questions you have already answered that came in the group, but I noticed there was another one that had not been answered. But I also just want to give an opportunity to our listeners. If you have any question, we can take that, maybe just one, and because we're already over time. But while we wait for that, I just want to give each one of you an opportunity to do just in 30 seconds, what would be your take-home message for everyone who is listening today around the pandemic agreement and the call for equity? Let's start with you, James. 30 seconds.
I think people should meet, right now and not wait till later. They should draw up a plan that involves a worst case scenario, just to try to take a look, kind of a sobering look at what that might look like if the U.S. was to pull out of not only WHO but UNICEF and the Global Fund, if they're going to shut down the research programs at BARDA and NIH dealing with the infectious diseases, like and there's other things too, but like, just I would start with those and just sort of like, hey, take a look at what would that look like? I mean, you shouldn't wait till it happens to sort of like enact, then like be surprised, but you take a look at like what were the consequences of the worst case that the combination of Elon Musk and RFK Jr. are promoting, and just take a look at what that is, and then I think you can't really begin to react or strategize until you have an idea of like what you're dealing with.
Thank you, James. Let's go to you, Peter, quickly. 30 seconds. Take home.
I agree with Jamie on that point, and with Timothy's point about a need for African states to lead and chart their own paths forward. It's a big world. There are going to be some very bad things that happen, but every nation has the ability to make policy and even invest and collaborate with its regional partners toward health security and equity. And this is a time to recognize that we won't have the United States to lean on in the same way when it comes to funding, but there are other paths ahead. And so it's a time for South leadership. It's a time for others to step up, and let's make the most of that.
Thank you, Peter. Timothy, you have the final word.
Yeah, thanks. I think now being the final word, most have been said, but I think, yes, agreeing to the points that have been made. I think, yes, let's not relent in the kind of advocacy for the Africa group within in the negotiation team, not to relent in terms of the kind of asks that are being made, CSO, civil society, also to continue with this kind of push and advocacy for her to ensure that we move towards having equitable access to vaccines, medicines across the globe. Yeah, thanks.
Thank you very much. And on that note, we have come to the end of this panel discussion. Thank you to our speakers and to everyone who joined in to listen. Have a good day, good evening, wherever you are joining from. Thank you.
Thank you, everyone.